Millions of patient scans and health records spilling online thanks to decades-old protocol bug. Researchers say they found exposed patient imaging, as well as names, addresses, and phone numbers. Thousands of exposed servers are spilling medical records and personal health information of millions of patients due to security weaknesses in decades-old security industry standards designed for storing and sharing medical images, researchers have warned. This standard, known as Digital Imaging and Communications in Medicine, or DICOM for short, is the internationally recognized format for medical imaging. DICOM is used as the file format for CT scans and X-ray images to ensure interoperability between different imaging systems and software. DICOM images are typically stored in a picture storage and sharing system, or PACS server, allowing medical practitioners to store patient images in a single file and share records with other medical practices. But as discovered by Applite, a Germany-based cybersecurity consultancy specializing in digital healthcare, security shortcomings in DICOM may mean that medical facilities have unintentionally made private data and medical histories of millions of patients accessible to the open internet. Applite's research into DICOM systems, shared with TechCrunch ahead of its presentation at the Black Hat Europe this week, has discovered more than 3,800 servers across more than 110 countries, exposing the personal information of some 16 million patients. Applite said they found patient names, genders, addresses, and phone numbers, and in some cases social security numbers. The researchers, which scanned the intercom for DICOM servers for more than 6 months, found that these servers are also exposing more than 4.3 million health records, which can include the results of an examination, when the examination took place, and the referring patient's physician's details. Most of the exposed servers, more than 8 million records, are based in the US, followed by 9.6 million records in India and 7.3 million found in South Africa. Applite said many of the US-based servers are hosting data from medical practices located outside of the United States. Applite said that many of the US-based servers are hosting data from... Sina Yazimir, a senior IT security consultant with Applite, told TechCrunch that more than 70% of these exposed DICOM servers are hosted by cloud agents like Amazon AWS and Microsoft Azure. The rest are DICOM servers in medical offices connected to the internet. Isadon Mir said that fewer than 1% of DICOM services on the internet are using effective security measures. When we did this, we realized the medical organizations had started the shift towards the cloud and modernization. Big players went to the cloud because they could afford it and have the infrastructure, Isadon Mir told TechCrunch, but this digitalization forces small businesses that don't have the resources or budget just one DSL line to catch up. A legacy problem. The security shortcomings associated with DICOM are nothing new in 2020. TechCrunch reported implementation of this decades-old protocol at hospitals, doctors' offices, and radiology centers led to the exposure of millions of medical images containing the personal health information of patients. Now, almost 4 years later, the problem shows no signs of abating. Worse, Applite said it has discovered a new attack vector that could allow hackers to tamper with data within existing medical images, which the company will demonstrate at Black Hat on Wednesday. When we analyzed the servers, we found that 39 million of the health records are at risk of tampering, Yazimir said. Because of the nature of the medical records, you cannot trust them unless it goes through a whole process of manual verification. If an attacker tampers with the data, these records are likely useless, Yazimir said Yazimir. They can even inject the false sign of illnesses. The number of leaked records is increasing every day, Yazimir told TechCrunch, as more hospitals move to the cloud and more records are generated, but the wider program is not easy to fix. Yazimir said that while DICOM has security measures requiring their use could break many legacy products and systems. The Medical Imaging and Technology Alliance, which oversees DICOM standard, did not respond to TechCrunch questions. Of course, they are not going to respond to questions at all. That is, they probably don't know much about it, and they're going to have to go look at some security professionals to figure out what and where this information, or how this information is going to be dealt with. because I cannot imagine. I have a hard enough time upgrading this machine in the back behind me there and keeping that up to date with a Minecraft server on it. I couldn't imagine medical records.